Welcome to the inaugural Building Resilience for Health webinar hosted by Chemical Insights Research Institute of UL Research Institutes. Today's session focuses on protecting human health while adapting to extreme climate conditions. My name is Holly Henderson, and I'll be our moderator today. Before we dive into the exciting content we have prepared, I'd like to take a moment to go over a few housekeeping items to ensure that everyone has a smooth experience. Please make sure that your internet connection is stable throughout the webinar to avoid any interruptions. If you experience any technical difficulties, try refreshing your browser or rejoining the webinar using the link provided in your calendar invite. We'll have a dedicated Q&A session at the end of the webinar. Feel free to submit your questions at any time through the chat feature, and we'll do our best to address as many questions as possible. We encourage active participation throughout the session. Use the chat feature to engage with fellow attendees and share your thoughts or insights. This webinar will be recorded, and the recording will be made available to all registered participants after the session. Your feedback is really invaluable to us. After the webinar, you'll receive a brief survey. We appreciate you taking the time to share your thoughts and suggestions with us. That's it for the housekeeping items. Now, without further ado, let's get started with today's webinar. Today's webinar is the first in a four-part series on building resilience for health. Future sessions will focus on wildfires and wildland-urban interface, extreme heat, and indoor air quality. Please stay tuned for dates for the next three sessions, which will be held throughout 2024. Before we get started, I wanted to briefly introduce Chemical Insights Research Institute of UL Research Institutes. Most of you likely recognize that UL circle. You may have seen it on your electrical appliances. But what you might not know is that the original UL that most people are familiar with is now three separate and distinct entities with separate leadership, but a common mission of safety science. UL Solutions, which is a for-profit testing and certification company, UL Standards and Engagement, which is a 501c4 company focused on standards development, and UL Research Institutes, which is a 501c3 nonprofit focused on science research. UL Research Institutes houses 5 distinct research institutes. Chemical Insights Research Institute, or we call ourselves CIRI, is one of those 5, with a focus on promoting human health through research and awareness of the potential risks of chemical pollutants. Chemical Insights Research Institute is dedicated to scientific research, publication, education, and communication on environmental exposures resulting from technologies and practices, their impact on human health, and ways for reducing risks. Our research efforts contribute to safe working, living, and learning environments for the betterment of societal well-being. Science for a safer, healthier tomorrow. We have research initiatives spanning a number of topics related to chemical exposures and human health, including these. All of our research relates to environmental exposure risks. Therefore, we ask questions such as, what are the chemicals and particles of concern? How does human exposure to chemicals and particles of concern occur? What are the risks to human health, wellness, and productivity with a focus on vulnerable populations? What mitigation strategies can reduce the risks and improve maintenance? One of the most important aspects of our work is making sure that our research has an impact on society. So we follow a research to impact process that allows us to deliver meaningful insights with each of our research initiatives. First, when we see a need for new knowledge around a particular topic, we convene stakeholders to define public health risks and set a research agenda. Then we partner with experts in the field to conduct the research. We begin to publish our scientific findings, but we can't stop there. It's important to us that our research results be accessible, understandable, and actionable. So we need to storytell the science and use our findings to create standards, guidance documents, best practices, and educational tools and resources. To maximize the impact of these tools, we also partner with organizations like the U.S. Green Building Council, or USGBC, who can help us extend our reach in providing resources and making an impact. Partnerships are key to delivering findings and effectively sharing actionable information. I'm honored today to be joined by 3 expert panelists. I'm going to ask each of them to introduce themselves. Marilyn, can you get us started?
Yeah, thank you, Holly. So I'm Marilyn Black. I lead the Chemical Insights Research Institute, and we are delighted to be here with you today to share our current knowledge and concerns about weatherization and the impact that it's having on the built environment and human health. And I'll hand it over to Seema.
Thank you, Marilyn, and thank you to the entire CIRI team for inviting me here. I'm also delighted to join you here to discuss a topic that's both close to my heart and a priority area for USGBC. And as principal for Healthy Buildings on our newly formed innovation and research team, I live in this space between emerging research, problems, opportunities, and then how to change practice at scale. My background is mainly in research in environmental health and indoor air quality areas, and then also in sensors and technology and commercial real estate. And my primary lens now with my USGBC hat on is how can we use the mechanisms available to us through the green building movement to drive the change needed to address both climate change adaptation and mitigation in tandem. So with that, I'll hand off to Jamie.
Thanks, Seema. I'm delighted to be here today. I've been working in the green building industry for more than 20 years. Several different roles: educator, facilitator of conversations on actions, market engager, program director, content creator, all with a focus on transforming our building spaces and the places where we inhabit. And so this topic is very near and dear to me and really brings my last 20 years together. And I'm just delighted to be here today.
Thank you all so much. So let's dive into the topic at hand, resilience for health. We know that resilience has been a hot topic in the building industry lately. Marilyn, can you tell us more about what resilience for health entails?
Thank you, Holly. So yes, resilience has been a hot market topic for a good reason. As the effects of climate change intensify, we're seeing more and more weather perils, things like hurricanes, heat waves, wildfires, and they all affect public health. Last year alone, there were 28 separate weather and climate disaster events with losses exceeding $1 billion each. This particular slide shows you a snapshot of the billion-dollar weather events that have occurred over the last few years. And as you can see, there are quite a few, and they are impacting the whole country and even beyond that in the world overall. So as of today, what do we know? We know today's sustainable design approaches and energy codes are primarily focused on climate change mitigation, with the emphasis on trying to reduce carbon emissions to mitigate the impact of climate change. But at the same time, we know that resilient design approaches often focus on the durability of a structure. That is, a building's ability to mitigate the impact of these external climate stressors, things like high winds, storms, fire, extreme heat, snow, storm surges, floods, a lot of moisture. But what's missing from those approaches is the consideration of the inside of the buildings. There are also many internal stressors occurring that can contribute to a building's resilience and ultimately affect the health of people in the building. These include things like chemicals, molds, particles in the air, temperature, humidity, dust, allergens, and microbiological contaminants. And we can't think of the outside and the inside in isolation because they impact each other. Depending on how durable the outside is, the inside can experience a range of impacts. Even if there's no exterior damage to a building, the building materials can behave differently. resulting in poor indoor air quality and more exposure for the people inside. This is especially true when sustained power outages take away our ability to condition the indoor environment and end up with elevated heat and humidity on the indoors. Then we start to face more extreme conditions as such. And when buildings do fail themselves, it often creates waste that can be hazardous to our air, to our water, to our ecosystem overall, based on materials that have to be disposed of. And this also requires new materials for repairs and replacement, which can have an environmental cost, but also offers the opportunity to seek more benign alternatives. So when we think about resilience to climate change, we also need to consider not just the billion-dollar disasters, but the everyday conditions that we're facing. If we're not responding to the big events well, we're certainly leaving individual homeowners and building owners to deal with the small, common events that we are seeing. These daily events are often another missing component of the resiliency discussion. But realizing and dealing with the new normal beyond what we consider catastrophic events is essential for us. Therefore, when we consider what our sustainable design approaches need to be and what we need to account for, we know that focusing only on climate mitigation can have unintended consequences. So instead, we need to design for both climate change mitigation and climate change resilience, which means, what do we need to do? Well, proactively incorporating design measures that factor in the projected climate over the lifespan of the building, designing for the new normal, and consider the impact of design on human health. There are important reasons why we need to do that, namely to protect human health. Climate impacts can have significant human health implications, and in relation to that, we're seeing some of those now. We're seeing things like increased heat-related illness and death, increase in cardiovascular illness, association with asthma, allergy-related illnesses. We're seeing water-related and food-related infection, drowning and injury, and stress-related disorders among people. And these are just some of the impacts, not a true comprehensive list. So when we talk about human health, we know that certain populations are more sensitive than others to risk. And these include infants and children, aging adults, pregnant people, and vulnerable populations, meaning those groups without accessibility to health care or resources for safe places or information. So at CERI, we realized all of this, and we started to see a real need to expand the way the building industry was talking about resilience. We wanted to make sure that human health was front and center, and that things like indoor air quality were part of the conversation and discussions. In order to have an impact, we knew we needed to bring diverse perspectives to the table. We saw an opportunity to bring together building practitioners, public health practitioners, scientific research, policymakers to discuss the issue of resiliency for health. So last August in Atlanta, we brought together a group of thought leaders across these key areas. But to be successful, we also knew that we needed to partner. And as a global leader in green building, we knew that the U.S. Green Building Council would be a perfect fit for us. So now I'm going to turn this over to our esteemed partner, Seema, to share her perspective on this effort.
Yes, thank you, Marilyn. And for us as well at US Green Building Council, while resilience has risen to be a priority, we operate within this broad mandate that you sketched so beautifully in your slides there that includes health, decarbonization, sustainable finance, and many impact topics that live within our umbrella. And so we really rely on strategic partnerships to drive impact in a focused way on priority topics. And your and CERI's leadership and call to action on resilience for health could not have offered a more timely opportunity for us to further that agenda along with you and along with all the esteemed leaders who came to the summit. And given the spotlight for us that we recently placed on resilience. And I cannot resist at this moment adding, because today is the day that the upcoming version of LEED v5, it enters public comment. And you'll notice in the language that resilience is elevated from a pilot credit to a prerequisite, in our recognition that extreme weather events are affecting every community and that adaptation and readiness are critical. So this was a very timely and important strategic partnership for us with you. And we also knew that when wrangling a group of 40 experts, we needed a seasoned facilitator. So that's where Jamie came in, who you met earlier. Having someone with her background in architecture, sustainable design, resilience, and experience facilitating was a perfect match. And before I hand over to her to tell us why she took this on, I can't resist telling you this photo here is an illustration of her magical facilitation skills. We had a fire alarm drive us all outdoors, and Jamie used the unexpected moment and opportunity, beautiful weather, to get us into a photo. So that's what you're seeing here. Over to you, Jamie.
Well, I was really so honored to be asked to facilitate this respected group of professionals that represented the built environment, public health, and then, of course, our scientists and researchers. Because one thing that I love to do is to make connections between different groups of people, and really with that focus that collectively we can do so much more. And when we think about market transformation and we think about all of the challenges that we face right now with climate change and really centering people at, that main challenge of ours, we're going to need a lot of different voices and expertise. And so my role on this day was really to help provide those connections, but then also point out where different languages were being used. And so in some cases, we found that we had folks that were saying the same thing, but they were speaking in a different vernacular. And then being able to graphically represent the ideas that were emerging and the outcomes that we were hoping for, and then promoting further inquiry. And so it was just quite a pleasure to be working with this group at this moment. And I'm just eager for now this effort to continue again in that collective impact momentum.
Thank you so much, Jamie. As someone who got to be in the room for the event, I can tell you there was a lot of energy around this topic. But we know it wasn't just the beginning of this conversation. So I'd like to share a little bit about what's been done around this topic since the summit. So directly following the summit, we put together a brief summary statement that summarized the conversations that we had. That's publicly available on our website. So if you want to learn more about the summit, I encourage you to check it out. You'll also see it in the chat. We also saw a need for a way to share the many resources that the summit attendees had on these topics. So with their help, we created a repository of resilience resources that's also available on our website. We reconvened at the U.S. Green Building Council's Green Build conference last fall and began to make further connections with USGBC's Resilience Working Group. We also convened a CERI task force focused specifically on protecting community health before, during, and after wildfires. We're excited to work with this interdisciplinary group to produce guidance for the public. We also foresee future working groups coming out of this effort. So now that we've done a level set on what we mean by building resilience for health, let's continue the conversation with our three panelists. We have a few questions prepared, but we want to hear your questions too. So please use the chat function to enter your questions at any time, and we'll get to as many as possible at the end. So let's start by exploring the why behind all of this. The need for changes in the built environment is becoming increasingly evident, as Jamie said. From your perspective, what are the primary drivers behind these changes? Jamie, can you help get us started?
Absolutely. So you've already heard, we've been at this for quite some time now. The LEED system has been out in the marketplace since the pilot in 1998. And there's been so many other programs and frameworks that are driving really important changes in the built environment. So why 20 years later are we having this conversation still? Well, the game has changed. So up until now, we've really been thinking about, in many cases, buildings in isolation or making those connections to other buildings in the community. But at this point in time, we're now asking our buildings to do a lot more. We're asking our buildings to generate electricity, right? To become energy sources, not just constantly demanding energy from the grid. So we're asking for it to have a bidirectional relationship with our power grid. We're also asking our buildings to power our transportation, electric vehicles. In addition, we're asking a lot more questions about what's happening through the industrial processes on the manufacturing of materials and what's included in them, in addition to the overall process of manufacturing what ends up in our buildings. And every sector is now trying to determine their roadmap to decarbonize by 2050, to get to the administration's goal of a net zero emissions economy by 2050. And of course, who is at the center of all this? It's people. And so we have an initiative now, Justice 40. 40% of the overall federal benefits are going to be flowing to disadvantaged communities. So we really need to be in lockstep with these other sectors. And that is why I'm so excited now to be part of the Department of Energy, because these sectors are getting worked on by colleagues and our staff scientists at national labs, 17 of our national labs trying to tackle this, in addition to all of our industry partners and stakeholders and nonprofits and associations in this space. So all of this is the reason we're just, turning up that dial. We see that 2050 goal. We've got some interim goals, and then we're seeing that the climate is in fact changing and having dramatic impacts on humanity.
Thank you, Jamie. So it is a really big piece of the puzzle, and really having people at the center of that. I'm curious if Marilyn or Seema, if you guys have anything else you'd like to add to this about what's driving the need for change in the built environment, or even in your in other sectors.
Yeah, I can just add that I'll actually quote a wonderful colleague, Jason Hartke from the International Well Building Institute, who said, let's not make all the retrofits and upgrades that we are going to make to the built environment to meet our climate mitigation commitment goals. Let's not make them a missed opportunity. Just yesterday, the Biden-Harris administration released a major report, a national blueprint for the building sector. And there's some very ambitious targets in there that we are going to be changing the building infrastructure at a speed and scale that, I know the word unprecedented is overused, but it is unprecedented. And every time we do touch a building, I think Marilyn referred to this earlier, we cannot afford to have anything we do for climate mitigation worsen health conditions or adaptive conditions. And in fact, there are so many opportunities for co-benefits to health that we should, at minimum, start there.
Thank you so much. The next topic I'd like to discuss is one that's near and dear to your heart, Marilyn. We know that research often provides valuable insights into improving building practices for better health outcomes. So how can the findings from research be effectively translated into tangible actions or even policies within the building industry, ensuring that they have a meaningful impact on the ground? So what do you think, Marilyn?
Yeah, well, Holly, you know that research is dear to my heart, and I believe that we can learn a lot about research that we can take into actionable forms. And the one example that I guess I would like to bring forward is the research that we're doing on weatherization of materials. And everyone, I'm sure on this call knows that the indoor air quality can be a significant issue from a health perspective, and that people are spending 85 to 90% of their time indoors, whether it's their home or their school or their office. And while they're in there, they're breathing air that is full of a lot of chemicals, a lot of things like volatile organic chemicals. And we know that all of the building materials that we use are the source of these chemicals. And the one thing we're learning in our weatherization research now is that if we take kind of our standard materials, and these are things like our floor coverings, our wall coverings, our insulation materials, things that we use to construct and design the buildings, and expose these to elevated temperatures or higher humidities than we normally consider, that we see the emissions going up significantly, which means that most products now are being tested and verified through our various certification and green programs at 23 degrees C, 50% relative humidity, and verified at those particular conditions. But with the weatherization changes that we're seeing, those conditions are changing. And so in the research, it shows something like, and I'll take a hardwood, manufactured hardwood flooring as an example, that we can see the emissions increasing by hundreds of percent over what they might be at a normal 23 degrees C. And not only are we seeing the total emissions increasing, but we're seeing potentially chemicals that we wouldn't ordinarily see. So it's possible that we're going to cause these more hazardous type chemicals to emit from our products. So we're doing this sort of research. We're gathering the information, and we look forward to sharing all this not only with manufacturers, who are kind of the first stop at, oh, look at this and look at what can happen. How can we alter our chemical composition in these products to avoid any sort of hazardous or toxic situation from occurring. And we can also take this a further step and look at the programs we have in place to control these emissions, either through our certification programs or building programs, and maybe modify the conditions under which these things are tested to get more relevant information for weatherization changes we're going to be seeing. So the information we gather from research is extremely critical to informing and engaging potential changes for the betterment.
Great, thank you. So now let's turn our attention to how we can drive change. What market transformation tools can help us drive resilience for health? So for example, we have building codes, regulations, voluntary standards like LEED. How can these tools be updated or revised to better prioritize the health considerations? So Seema, why don't you help us get started on this one?
Yeah, my mental map for drivers of change in the built environment, or how does market transformation happen, has three parts. And so this is a bit of a cartoon, so bear with me. I am a former researcher, relatively new to the world of market transformation and green buildings that my co-panelists and many people in the audience might live and breathe. But broadly speaking, to happen bottom up and voluntarily, there needs to be desirability, feasibility. This is the whole world of innovation driven by consumer demand. And then in a top-down sense, there needs to be policy requiring action, which can be a challenge actually for health in the built environment, because there are many players and sectors that have a role in creating health resilience in buildings, which is currently what we're talking about, or other health-related issues and solutions, and they can be siloed, and there is no central accountable body. So the consideration of regulation by whom, for whom, can get quickly quite complicated when we're talking about health management through the built environment. So there's market demand on the bottom and regulation on the top, and then really the theory of change for green buildings is that by codifying a set of voluntary standards and making performance transparent, we can incentivize through tools like LEED, or there are many building standards and frameworks, as Holly referred to, or I think Jamie talked about that, launched by others, and then use that kind of in-between tool to test and inform new ways of designing and operating buildings. So green certifications really fit into this space where new problems or solutions affecting the building industry have emerged, but the market alone is an insufficient driver for the change we want to see, and regulations have yet to catch up. And it can't be overemphasized. So I'll echo. Jamie has already given voice to this, but along the way, the green building movement, we talk about LEED and the rating system as a driver, and that is a big one. But the green building movement has cultivated a group of champions and pioneers engaged in research, innovation, advocacy, education, and that community is a real companion to all the various rating systems and standards, and is very key to the theory of change. And in terms of how LEED itself specifically is changing and is addressing resilience, I think I'm going to leave that on a cliffhanger and invite everyone to check out the public comment draft and comment, please.
That's great, Seema. I have to say, I know the other panelists here, Jamie and Marilyn, have both seen a lot of market transformation as some of those pioneers. So I'd love to hear from them on this one too.
Yeah, I'd love to chime in on this question. I see these above code programs, the voluntary green building certification frameworks, as really the proving ground of what is possible. And when we walk back to that question of translating the research into action, this is where the action is. And so at a place like the Department of Energy, within our building technologies office, we're working through this life cycle every day, where we're starting at that early concept design research effort to the later stage applied research, starting to have the demonstration projects, and then taking those new solutions and the technologies and the processes and going live with them in the market through market transformation efforts like an above code program. And it is through that we start to provide more awareness and education and technical assistance. And then our colleagues who are very much involved with the energy code process, they start to see the proposals come in based on what's happening in the above code arena. And that's how we start to raise that floor while continuing to push that innovation and having that feedback loop to the researchers and really trying to figure out, okay, what other optimizations do we need to make? What's not working in the market? Where are we having, impacts that we didn't realize we were going to have? What's the intersection between the energy efficiency, the decarbonization efforts, and then the non-energy benefits and the impact on humans and human health? And so all of that is part of that life cycle, but it's just these above code programs play such a critical role in helping us test out and prove, again, what is possible so that we can point to it, we've done it, and now we scale from there.
Marilyn, would you like to add anything?
No, well, I think those are great comments, and as I indicated before, we really are learning a lot from the research, and our experience has been in the past. When this sort of research information is developed and made available to the market, that the awareness and education on it can really make an impact, because no one is really trying to do anything intentionally. That most of the results that we're seeing, especially from the building materials, is unintentional, right? We just didn't know that this was going to be occurring. So by getting that information out, I feel a lot of trust in manufacturers that are going to look at that and really go back to their drawing board and look at their formulations and chemicals that are being used and make the changes that are needed to continue to have good low emitting products in the marketplace and good indoor air quality.
That's great, you guys. I really enjoyed that conversation. So now let's turn to another important topic. In the context of building better structures for health, how can we balance that need for innovation with the importance of maintaining both affordability and accessibility, especially in those underserved communities? Jamie, what do you think?
Yeah, this is the toughest part of the equation. And this is a constant conversation for us at the Department of Energy and with our colleagues at the national labs. We're looking for strategies for cost compression and how to minimize the impacts on low-income communities when electrifying buildings. Concerns what will happen when we start to do the system change out, bring in new technology. So one core competency or capability of the Department of Energy, science-based, focused on research and deployment efforts, is we're able to infuse in the market a lot of funding. And we do that in a lot of different ways. Historically, it's mainly been through our funding opportunities, research projects. But in the past few years, we've come up with a new model called prizes. And last year, really excited that we launched what is called the Buildings Upgrade Prize, or Buildings Up for short. And so this prize aims to build capacity to rapidly and equitably transform U.S. buildings. We're focusing on small commercial and residential buildings. And what it required was a team, but the team was a little bit different than historically. So the team was not just practitioners, but bringing together community benefit organizations and local governments and maybe some researchers, maybe some manufacturers, and coming together and proposing an innovative concept that would leverage the billions of dollars that is being made available through the bipartisan infrastructure law, utility rebate programs, and other funding sources, and having a set of buildings within communities that this team was going to work on building energy efficiency and efficient electrification upgrades. And again, the focus is really trying to target the underserved communities and those buildings that are existing and those buildings that are really struggling to operate well, and then potentially, have higher utility bills because the building envelopes do not work well, or they have outdated windows, or they're very leaky, right? And so the goal is to make these upgrades without increasing the utility bills for the occupants and the business owners. And so that is just getting started. It is a multi-year prize model. We call it instead of a competition, a co-opetition. And the teams, they get technical assistance from our national labs and from other industry experts. And it's going to be really interesting to see how these teams in places all across the US can help to start to transform our existing buildings, which is something that we're really challenged with, and we're continuing that conversation of how do we do retrofits, how do we do deep retrofits, and how do we do this in an equitable manner?
I love that co-opetition. I'm going to mention something for the audience right now. We're looking forward to getting everyone's questions. To clarify, please use the questions section to submit your questions, not the chat. I'm sorry, I misled us earlier on that. So put your questions in the question box. So for our next question, let's see. Now let's turn our attention to who needs to be at the table. So given the complex nature of building design and construction, who do you believe needs to be involved in the decision-making process to ensure a holistic and really an integrative approach towards building resilient and healthy buildings? Seema, I know USGBC has done a lot on this, and I'll be curious to hear what you think about that.
Yeah, and I think that word integrative is really key here, that who needs to be involved for it to be integrative. And we've all talked about, this was a key topic in the summit, and it's been threaded throughout today's conversation as well, just the importance of solutions being integrated and not siloed or redundant or competitive with various problem classes. And this is a hard question to answer. It's my favorite question and a hard one, because the right answer in my mind is everyone. When it comes to health, it's very hard to think of a stakeholder group that isn't invested in some, and when I say a stakeholder group, I don't mean within the building industry, I mean in the world, that isn't invested in some way and that doesn't have its unique leverage point to influence building resilience. And so this ties back to the discussion of market transformation tools in my mind, and what groups, and really, I think the charge is thinking strategically about what groups and sectors have the agency and the incentive to make buildings more resilient at various tables. And so, to throw out some examples, there is the core group of building professionals, owners, architects, engineers, out through the whole project life cycle, and certainly important to have them all involved in an integrative process. But then there's others beyond our building community. There's investor and finance community, where resilience for health is concerned, and this has come up today. Researchers and innovators have a very big role to play, given the rapid emergence of new knowledge, new tools. And then health professionals are critical. And that was something that made the summit very exciting to me, that we were able to bring that community in to talk to building professionals and researchers. And for health professionals, equitable health promotion is the cornerstone of their practice. And primary care providers as well have very special relationships of influence with people. So I could go on and on, but I think to wrap up, I'll say, I think of this less as a case of identifying all the people and then trying to bring all of them at the same table, and more about appreciating the types of expertise that is out there. And I'll echo Jamie. She said this in the beginning about the facilitation role, creating alliances and bringing relevant know-how from fields into each other, which requires learning each other's languages. So my visual image here is we have a lot of nodes, and we want to increase the connectivity between nodes. We're not trying to create a more giant dot.
Great point. So we had a question come in the Q&A, and I just want to pose this to all the panelists. So what are some examples of strategies with co-benefits for human health and the environment?
I think that one's for me, Holly. Sorry, I got distracted by another question in the chat.
Okay.
A example is electrification of homes. So, gas stoves, we know have, so that's an example, and I'm sure there are more.
That's great. Let's see here. I've got a couple of other questions. So you were talking a little bit, Seema, about stakeholders. So when we think about collaboration between these various stakeholders and how crucial it is to addressing complex challenges related to building health, could any one of you share examples of successful collaborations that you've seen with initiatives or partnerships that have effectively improved health outcomes in building design and construction?
I can share one, just showcasing the work of our Center for Green Schools at USGBC, and especially spurred by the COVID pandemic. The center did a lot of work bringing, building school administrators together with indoor air quality experts, the research community, and policymakers, and have created a lot of tools and connectivity between communities that I think have really moved the needle for how schools, various schools that participated and that now have access to these resources that were created. I want to make it clear, in partnership between many entities and agencies. So the center really played this kind of connector role that I see CIRI as playing now, which I don't have specific examples then of, there are a lot of examples and they're in the published canon, but of where then schools were able to take some of that know-how and drive it into design and construction and fundraising.
That's
Yeah,
great.
hey, thank you, Holly. I think I've got something to add to that particular question because again, one of our key studies was actually done in a school as well because school environments are often open for research initiatives to take place. But we did a multi-year study in a school looking at construction materials and furnishing materials that were being used, primarily working with the architects and designers to choose materials that would require minimal maintenance, or the least amount of maintenance that would require the use of chemicals on a frequent basis and things like that. And after, I believe it was 3 years, and we followed the health outcomes of the children in the school, as well as the test scores of the children performing over that time. And we found that with materials chosen and minimal use of chemicals in the school and use of vacuum cleaners with HEPA filtration to remove small particulates and things like that, we saw a dramatic improvement in the indoor air quality overall. And also we saw a decrease in asthmatic responses to the indoor environment, and a reduction in available pollution and like VOCs, as well as some of the microbiological contaminations. So proper design and implementation of maintenance processes made a very positive impact on the health outcomes of the students.
That's interesting because it makes me think about the COVID-19 pandemic and how that really important. It really emphasized the importance of indoor air quality and ventilation systems and how to mitigate the spread of infectious diseases. And so when you mentioned HEPA filter, I was thinking about building designs and technologies and adapt to meet these new health challenges while still promoting energy efficiency, which I know, Jamie, is front and center on your mind. Just curious how we do that balancing act.
Yeah, I mean, it's exactly that. It is a balancing act. And when we think about, creating spaces that people can inhabit, particularly during climate events, and, designing high performance buildings, we want to try to design our buildings with a tight envelope, but we need to ventilate the buildings. We need to be thinking about what we're bringing into the buildings in terms of the materials that are going to be covering the walls and the paints that are being used. And then we need to be able to flush that out. You can go really extreme on one, and then you may have to start to balance out on the other, right? So you don't want it so tight that your system has to overwork, but that's part of that integrative design process where the designer and the engineers and the contractors need to be working very closely together. And also, my days are spent in the residential sector, and talking to builders, what they're finding now is that if they make these homes too smart, too innovative, they're finding out that the occupants may not actually be using the technology that we're hoping. And so there's a balancing there too on occupant education. And so sometimes, getting back to the basics and making sure that, we're not over designing, but we're designing with the issues of like passive survivability in mind, the health impacts of the humans inside. But it is very much that balancing act. And I also just want to add, in thinking about who needs to be part of the conversation now, I've been spending a lot more time learning about projects and groups that have been very successful in engaging community members. And, coming out of this pandemic, we're finding that more people are spending time in their homes. And while, the green building programs have done so much within our commercial sector and within our public spaces, our homes are the places where we're spending the most time with our families, and could be places that are also, impacting our health too. And so when we go to make these changes and we go to try to upgrade our existing homes, for example, building that trust in that local community is going to be so important, and identifying those in the community who can talk to the residents. And so through community-based organizations, or, if we're learning a lot from environmental justice organizations. I want to add that that's a new layer in this, as we are trying to equitably decarbonize, but also do so in a healthful manner that's going to support human life through all of the planetary changes that we're going through now. So just another group to consider in this too. Who are your allies out there in your communities that you could bring on board to help build trust with those folks in the community for the changes we need to make.
I like that, building allies with trust and training, it sounds like, with some of those technologies. We have a great question in the question box. So standardization is an important part of ensuring safety of communities. We all have seen that over the years. So what role do you see standardization playing in addressing human health within our changing climate?
I can start us off because it's a topic very close to my heart. It's maybe the thing that keeps me up at night in both directions. I love it. I hate it. So I think standardization is undeniably really important for quality at scale. If we want, we cannot expect individual actors to keep reinventing or inventing the wheel on how they're going to act. They need some standardized protocols available. It's also really important for the learning loops that are very critical to the theory of change for green buildings. We want to be able to have what we're doing, what we're trying through voluntary leadership standards, then inform what's working and not. And to test and triage like that, we need to have some level of standardization and consistency in what people are trying and how they're trying it. And it's also really important for equity. A cornerstone of standardization, another way to think about it, is that the same standard for all. We don't have differentiation there. And so I'm a huge driver at USGBC. Partly why partnerships are so important to us is that we really want to drive toward, sometimes we call it harmonization. If the evidence base is such that we cannot standardize based on evidence alone, we want to harmonize anyway for these benefits. And however, on the other side, I will say that while we're moving toward harmonization and standardization, health is a little bit unique in the ecosystem of sustainability and high performance buildings, in that humans are not a standard mold. We're not built on a standard mold. People are really different, communities, populations, regions, especially where resilience is concerned. I'm here in California, I worry about wildfires, but not extreme heat as much as my colleagues in Texas or my family in India. And so I think we need to there are some really good emerging research out there. I'll cite work by Adele Houghton, one of our summit attendees, who has, a great protocol. There are others. She's just one illustration of work that is pushing to standardize in a context specific way. So while we're standardizing, we don't lose that individuality and particularity of a population and a particular group and their wishes and needs.
So good to be thinking about the regional aspects. So I have one more question. Where can I learn more about the weatherization research that Marilyn discussed? Is future research planned on this topic? Marilyn, can you address that one?
Yes, we are actively conducting that weatherization research, but we have published our first report on that, which is available on the CERI website or in the resource library under technical reports that talk about some of those initial building materials that we evaluated at elevated temperatures. So You can go there to find that information, and then just stay in touch with us and you'll continue to see that information shared.
That's great. And that's what we're going to talk about next. So what a great discussion. Now we have time. Oh, let's see. I'm on the wrong place. Sorry about that. Thank you for your insightful questions, and we would love to stay involved. A few ways you can do so are by reviewing the resources on our website. You can see our QR code on the screen, and that will take you to that repository of resilience resources. The link is also going to be in the chat. We're suggesting additional resources to add to the repository, and you can email us at chemicalinsights@ul.org to submit a resource. Stay tuned for more guidance and best practices. The best way to do that is subscribing to our newsletter, and we're going to put that in the chat as well, and following us on social media. And finally, we hope you'll join us for the rest of this webinar series. So these are our topics for the future webinars. Stay tuned for dates and speaker lineups. We're super excited about this. Thank you so much for joining us today. We really appreciate your time and attention. Again, please stay in touch, and we'd love to hear from you.